Okay, so let's get right into a topic that is, no exaggeration, a matter of life and death. It's one of those things where knowing what to do in a matter of minutes can change absolutely everything. Today, we're breaking down anaphylaxis.
Right off the bat, that clinical definition tells you pretty much everything you need to know about how serious this is. This isn't just a minor allergic reaction or a bad rash. We're talking about a full-body, life-threatening emergency. The key words to lock onto here are severe and systemic, meaning it affects the whole body, all at once.
And this is why we need to understand it. In the UK alone, roughly 20 people die every year from anaphylaxis. But here's the crucial point, and it's the entire reason we're doing this explainer. It is treatable, it's manageable when it's recognized, and when someone acts fast. So what you know and how quickly you act can literally save a life. So what is actually happening inside the body during one of these episodes? Well, in a nutshell, it's a huge case of mistaken identity. It's a massive, and I mean catastrophic, overreaction by your body's own defense system. The technical term for this is a hypersensitivity reaction, but let's make that simpler. Think of your immune system as this highly trained elite security team. Most of the time, it's brilliant at spotting real threats, right? Viruses, bacteria. But in this case, it completely misidentifies something that's actually harmless, like a peanut or a bee sting, and flags it as a major enemy combatant. And then it launches an all-out war. Now, what's really important to get here is that this is a two-step process. The very first time you're exposed to whatever the trigger is, you don't actually have an anaphylactic reaction. Instead, your immune system just quietly gets sensitized. It creates these special antibodies called IgE that latch onto cells called mast cells. You can think of it like it's putting up wanted posters for that substance all over your body. Then, the second time you encounter that same thing, those now sensitized mast cells scream, "It's them!" and they hit the big red button, releasing a massive flood of chemicals, like histamine, that cause all the chaos. So, what are these triggers? Well, a lot of the time, they're things we run into in everyday life. The most common culprits are foods, especially things like nuts, shellfish, eggs, and wheat. Certain drugs, like some antibiotics, can do it too, and of course, venom from bee and wasp stings. But sometimes, and this is the really tricky part, the trigger can't be identified at all. That's what's known as idiopathic anaphylaxis. Okay, so we've covered the why. Now let's get to the most critical part, the what. What does this full body meltdown actually look like? Knowing these signs is, frankly, non-negotiable. In a true emergency, it's so easy for your mind to just go blank. That's why medical professionals rely on a simple but really powerful tool to stay focused, the ABC approach. Let's break down exactly what you need to be looking for. First up, A is for airway. This is the most immediate danger. That chemical flood we talked about causes tissues to swell up. So if you see someone's lips or tongue starting to swell, or if their voice suddenly sounds really hoarse or they're struggling to swallow, that's a huge red flag that their airway is starting to close. Next, B is for breathing. The reaction doesn't just stop at the throat, it goes for the lungs too. Those same chemicals make the airways in the lungs constrict and tighten up. This is what leads to wheezing, that high-pitched whistling sound when they breathe. You might also see a cough that just won't stop, or they might complain that their chest feels really tight. And finally, C is for circulation. This is where that systemic part of the reaction really hits home. All the blood vessels throughout the body basically just open wide all at once. This causes a sudden, catastrophic drop in blood pressure. So the person might feel dizzy, they might look really pale and feel clammy, or they could even collapse. This is what's known as anaphylactic shock. Now, alongside the big ABCs, you might see some other signs pop up. Widespread hives and swelling on the skin are super common. The gut can get involved too, leading to bad cramps or vomiting. And then there's this really powerful neurological sign. Many people report a sudden, overwhelming feeling of intense anxiety or impending doom. It's not just panic. It's the body's own alarm system screaming that something is terribly wrong. Okay, recognizing the problem is step one. Step two is knowing the solution. And when it comes to anaphylaxis, there is one clear, undisputed, life-saving action plan. This is it. This is the crucial four-step plan. First, call for help immediately. This is not something you try to manage by yourself. Second, get the person to lie down flat and raise their legs. This just uses gravity to help get precious blood back to their vital organs. Third, And this is the most important one. Administer intramuscular adrenaline into their outer thigh. Do not hesitate, do not delay. And fourth, if there's no improvement after 5 minutes, you give a second dose. So why adrenaline? What's the magic here? Well, it's pretty much the perfect antidote. It does the exact opposite of everything the anaphylactic shock is doing. It constricts blood vessels to bring that blood pressure right back up, it gets the heart pumping properly again, and critically, it opens up the airways. That's a process called bronchodilation. Adrenaline is the emergency reset button. So, the adrenaline has worked. The person seems to be breathing easier, they're looking better. You might think the immediate danger has passed, but the emergency isn't over yet. What happens next is just as important. And the reason for that is a really dangerous phenomenon called biphasic anaphylaxis. You can think of it like a second wave. The symptoms can come roaring back hours later, even when the person hasn't been anywhere near the original trigger. This is exactly why every single person who has an anaphylactic reaction needs to go to the hospital for observation, no exceptions. After the emergency, the follow-up care is pretty straightforward, but absolutely vital. After a period of observation, a blood test for something called mast cell tryptase can help doctors confirm that it was in fact anaphylaxis. The patient is then referred to an allergy specialist to try and figure out the trigger. And, most importantly, they're prescribed their own adrenaline autoinjector and taught exactly how to use it so they're prepared if it ever happens again. You know, we started this whole thing by saying that anaphylaxis is treatable when it's recognized. The ABCs, that 4-step plan, this is life-saving information. So I guess the only question left is the one you see right here. Now that you know the signs, would you be ready to act?